Hi, I'm Dr. Chris Driscoll with Omaha Integrated Health, and I thought I'd take a little bit of time on my day off to answer some questions that we get that are very common that people want to know about knee care. So let's start with the first question here. Do I need a referral? Nope. You can call the office, make an appointment anytime. You don't need a referral. What else? Does insurance cover your treatments? Yes, we accept all major insurance. We accept Medicare. We also even accept TRICARE if it says a secondary. However, make sure you bring your insurance card with us and we'll check it for free when you're doing your free consultation and see if your specific plan is covered. What else? My doctor said that I am bone on bone. Can you still help me? Well, that depends. There's a couple things to consider. First of all, was the diagnosis correct? I can't tell you how many times I have heard a patient tell me that they were bone on bone. And then when we run the x-rays and we start doing the exam, we see that it's not. In fact, most of the time the patient's not bone on bone. I even had one of our patients a couple weeks ago saying, I had two doctors tell me I was bone on bone, and she was nowhere near bone on bone. So a lot of times that is a misdiagnosis. It's often used as a guess. Sometimes they use it just to kind of let the patient know that their condition is really bad, and maybe they're too lazy to explain it. I don't know. I can't speak for somebody else, but I'm just telling you, most of the time they are not bone on bone. And then the second thing about that, if you actually are bone on bone, it still doesn't mean we can't help. We've treated a lot of patients that were bone on bone and still got a lot of relief, and they were still able to postpone surgery. So even if you are bone on bone, we still may be able to help. Number 4, let's see, what do you actually do to help the knees? The thing that we do the most is going to be hyaluronic acid knee injections, which leads me to, it looks like the next question. It says, what are the benefits of hyaluronic acid? Well, there's a lot of research that shows that hyaluronic acid knee injections can work several ways to reduce symptoms of osteoarthritis and improve the health of the knee, also improve your range of motion. Your knee already has hyaluronic acid in it. We all do. It's contained in a sac that surrounds and binds and protects the knee. It serves as kind of a built-in brace for you, but as we age, that knee takes more and more traumas over the years, and the cartilage that's responsible for producing the hyaluronic acid kind of gets beat up. And so it makes less and less of this protective oil, if you will. It's kind of like oil in the joint. And when it does, it also decreases in quality. So both the quantity and the quality of the hyaluronic acid inside the joint has decreased over the years as we get older. But the cool thing about having hyaluronic acid knee injections, that when you inject it back into the knee where it's supposed to be, it'll stimulate the cartilage that's there to actually start producing more and a better quality. It reduces the pain, obviously, reduces the inflammation and swelling, reduces friction, it reduces the stiffness, it will reduce or slow the degenerative process that's going on in there. It prevents the loss of the cartilage on the bone. It can stimulate new cartilage in bone and the surrounding tissue. It increases lubrication, and basically it works like a liquid sponge inside there. It separates the joints and keeps more space in between the joints so that it's not knocking and grinding together whenever you walk. It also helps eliminate a lot of that popping and cracking and creaking that you get whenever you walk. What else we got? I've had HA injections before and they didn't help. Hyaluronic acid knee injections. Okay, so why should I bother coming to you? Well, actually, there's a few reasons. First of all, they may have missed the spot. A lot of clinics around here use poor visual aids or none at all. So a poor visual aid would be something like ultrasound. It's really hard to see the definitive edges and the spaces that you need to see with ultrasound. It's kind of a messy picture. If you've seen a baby on ultrasound, you can see how bad the picture is. It's kind of the same thing with the knee. So a lot of times they'll miss it, and if they go in there blind, they can miss it altogether. If you miss it, you just kind of wasted your time. What else? The fluoroscopy. Somebody's asking about the fluoroscopy. So we do use fluoroscopy. It makes it easier so that we don't miss the sac. Fluoroscopy is basically, it's a high-tech video x-ray. That's really, if you're going to sum it up, it's by far the most advanced technology to be able to see into the joint. Also, if you've had hyaluronic acid knee injections and you felt like it didn't work, remember these things build on each other. The more cushion that you can put in there on a repetitive basis, the more that builds up, and it serves to work on the other. The other serves as a catalyst to move you along in your health and makes that space a little bit further apart and further apart and further apart. Now, there's a certain amount where you can only do so much and it will max out, but they do build on each other. Oh, the other thing about the hyaluronic acid is that we use actual hyaluronic acid. We don't use the artificial, what is known as the chicken or the rooster shot. You may have heard about that. We don't use that. Those are avian products, and you're a lot more likely to have a reaction, an allergic reaction, and sometimes it just doesn't sit well in there. It can cause more inflammation and swelling. So we can use those products, and a lot of times it's the only thing your insurance will allow, and that'll be up to you whether you want to go that route or not. But typically, we do try to avoid that. What is the fluoroscopy? We kind of covered that already. How long does each treatment take? Actually, about 30 minutes. You can be pretty much in and out. We've had patients that will literally come in on their lunch break and they'll be done before their lunch break is over with. Is there any downtime? Nope. You can go right back to work. You can continue on with your normal daily activities immediately after treatment, but we do recommend that you take it easy. I mean, this isn't the time to go hiring a moving truck or take on some hard labor. What else? Are there any side effects to the hyaluronic acid? Well, since your body already produces hyaluronic acid, for the most part, no. Now, you could have some mild temporary tenderness, some swelling, some redness, or some bruising at the site, but that's actually pretty uncommon. Probably the most thing we'll see on any of the patients is maybe a little bit of bruising. It's not really much there. They don't even limp out of here. Usually they're feeling better when they leave rather than when they when they get here anyways. So, all right. How long do the treatments last? Well, that was a little bit harder to answer because how long the treatment lasts varies quite a bit with each patient. Everybody's a little bit different. We have some cases where we've treated them and the pain was completely gone and we've never seen them again. We've got other people that may need treatment every 6 months. So the reason why it varies so much is because everybody's body is different and how you treat your body is different. So the outcome can be different quite a bit. I mean, some of this is age. You know, you're going to respond a lot better if you're 40 than you would if you're 90. We've had 91-year-old lady come in and she got treatment and she felt a lot better, but she has a lot of decay in there. So, you know, she's not going to recover as well and it's not going to hold as long with somebody that's that old. So age plays a role, weight plays a role, previous injuries, previous surgeries, and what kind of care you've had in the past, that's all going to play a role. How much degeneration you already have in the joint, how long you've had the pain, what you eat, what you drink, if you smoke or if you've had a history of smoking, even after you quit, it makes things a little bit harder to heal, a little slower to heal. If you have other disease processes, an autoimmune condition, especially like diabetes slows down everything. Sickness, a history of drugs, there's a number of things that can affect that. Also, how well you take care of yourself, not only afterwards, but before. You know, how healthy were you before you even walked in the door? Whether you exercise or not, how much exercise, how long you exercise, what type of exercise, how hardcore you are at your exercises. Genetics play a role. So there's a lot of things that do it, but in general, I mean, surgery is no different. All these things play a factor no matter what kind of medical care you have or whatever you choose. In fact, it's a lot harder for you to do surgery than it is to do this by far. So if you have any of those variables when you go into surgery, you're going to have you have a lot bigger chance of having a much poorer outcome. I hope that answers most, if not all of your questions. Remember, when you come into the office, the first thing you want to do, call the office, make an appointment. You'll meet with me. Your first meeting with me, your consultation with me is free. But you do want to bring your insurance card. That way, while you and I are talking and going over the problems that you have with your knee, the girls can check your insurance and make sure that it is covered, make sure that your plan covers what we need to do. If you have any MRIs or x-rays, bring them, or at least the CD or the paperwork that came with it, the report. We don't necessarily need to look at the actual x-rays if they're recent. If they're old, I mean, we're probably going to end up taking them again anyways. Depends on how old the MRIs or the x-rays are. We don't do MRIs, but we do x-rays and we do the fluoroscopy. So, but if you have them, bring them. Also, a list of your medications. You want to make sure you bring that because some of the medications can hurt your care. So we want to make sure that we're doing the right thing for you. And then lastly, just bring your smile. We love our patients. We enjoy our job. We enjoy what we do. We love watching people get better in here. And we probably play a little bit too much. But we're looking forward to seeing you in the office. Until then, have a great day.